The South African government talks a big game about the developmental state, but it has done very little to develop the skills necessary to administer a developmental state. So if you don't get those basics right, I don't think throwing money at the problem, as the NHI will do, is the actual solution.
Healthcare in Nelson Mandela Bay is on the verge of collapse. Joining me to discuss what is going on in Nelson Mandela Bay, Port Elizabeth, is Chris Hattingh of the CRA, my colleague. So Chris, you authored a client note briefing our clients about the extent of the problems in Nelson Mandela Bay. What exactly is going on there?
Thanks very much, David. It's a very unfortunate situation, but not one that should be surprising. I think with modern medicine, some of us will make the mistake of thinking that improved care, technological advances, cleanliness, those basic things we take them for granted, but you have to have the right ingredients, the right policies, the right incentives and systems in place. If you don't have those, then the quality of service will decline. You won't have access to the necessary ingredients, the necessary inventory, the necessary skills. Those things will slowly but surely decline, or the people who administer those skills will leave that area because they find they don't have the ideal working conditions to administer what they can best provide. So in Nelson Mandela Bay at the moment, the state of affairs is so bad that many doctors are calling on the Provincial Department of Health in the Eastern Cape to implement quote unquote crisis management, and that only limited healthcare will be available for the time being. So you're going to see things like rationing, you're going to see much longer waiting lists for more complicated procedures, and you're simply going to see more and more tension as people vie for those few healthcare opportunities that they can find at public healthcare facilities. The decrepit state of healthcare in Nelson Mandela Bay, I think, illustrates if you don't get the right ideas and the right policies in place, then things will decline over the medium to longer term. And that means, of course, that citizens who live in those areas will have access to lower quality care in terms of meeting their healthcare needs.
And it seems like an acute state of crisis. These doctors are operating under conditions of financial distress. The Livingston Tertiary Hospital Group, which is a series of several hospitals, there is no functional CEO, there's no urologist, there's no neurologist, no ear, nose, and throat specialist. The orthopedic capabilities also are not there, and also just basic cleaning and other associated services required to run a hospital. But now, all of this takes place, Chris, against the backdrop of a debate around national health insurance. And the very same government that's not able to deliver basic services is now saying, well, we need this kind of grand plan to finance healthcare. And I don't think in this operating environment that is necessarily a good idea. What are your sentiments?
So a few cost estimates of the NHI put the whole system or scheme, as it were, between 7 to 14% of GDP. So you're placing a massive amount of money and control in the hands of bureaucrats and politicians, because essentially the NHI seeks to monopolize the management of all healthcare, both public and private, in the hands of the state. Now, this is not to say that all politicians and bureaucrats are inherently corrupt or inherently tend towards inefficient and wasteful outcomes. But when you place that much money in one pot, and you have, for example, the NHI board administering that pot along with the Minister of Health and some other new positions that could be created, you increase the incentives for wastefulness and corruption. So let's say that we have GDP growth of between 5 to 10% for the next 10 years. The economy is booming. The government's coffers are seriously boosted, and they have much more access to money than they had ever before. Throwing money at the basic infrastructural system incentive issues in healthcare, I don't think will solve any of those issues. You're simply going to create an attractive target, as it were, for more corrupt, cronyist and inefficient interests, and that will result in lower quality healthcare outcomes for the vast majority of South Africans. If you wanted to fix public healthcare especially, you could look at getting the basics right in terms of piped water, in terms of inventory security, in terms of electricity, again, reliable electricity. So you need reforms, real reforms in the electricity space. And then you need to incentivize doctors and nurses to stay in South Africa. If you're going to want people to devote their lives to years of study and sacrificing time with family and friends to make sure that they've got the right skills to become healthcare professionals, you need to make sure that they have every reason to stay in the country instead of subjecting them to the bureaucratic mess that the NHI inevitably will be. The South African government talks a big game about the developmental state, but it has done very little to develop the skills necessary to administer a developmental state. So if you don't get those basics right, I don't think throwing money at the problem, as the NHI will do, is the actual solution.
Yeah, and Chris, the Minister of Health himself has admitted that the patient-to-doctor ratio, that's about one doctor to every 3,100 or so patients. So that is an enormous burden for a medical practitioner to carry on his shoulders. And now, Chris, what about the political thrust behind NHI? The ANC is weakening. There's been some polling numbers showing them hovering at around 40%. So alarm bells must be ringing at Luthuli House. Do you think this is part of a populist impulse by the ANC to try and shore up support amongst perhaps poor voters?
I think that's definitely a large motivational force behind the NHI. And a second aspect might be to retain the cadre systems that the ANC has managed to implement throughout various state organizations and institutions, the state itself, over the last 20 years. So if you create this new opportunity for control, systematic, top-down, bureaucratic, centralized management, then you ensure that in terms of retaining your control and extending it, you've got the best chances to do so. I think healthcare is very important to all citizens, regardless of socioeconomic background. So if you make the only way that people can access healthcare through the state, through your office or through your board or your institution, then you ensure that the probability is higher that they're going to feel pressure to support you and to vote for you and to maybe support you in other various ways down the line. So as we see the ANC becoming more desperate, they might push through measures and reforms such as the NHI, the basic income grant, prescribed assets. All of these things, I think, become a more real possibility the more the ANC feels pressed into a corner. It's all couched in the rhetoric of caring for South Africans, of increasing their quality of life. But if we increase the amount of bureaucracy and political control over something as important as a person's healthcare, unfortunately, given our history of state capture and waste and inefficiency, we simply incentivize again and increase the probability that more cronyism and waste will occur in the future. Those South Africans who are able to go overseas and get quality care will continue to be able to do so, but the vast majority will be subject to lower quality public healthcare facilities. I don't think you're going to have the skilled people in the country. You're not going to retain them, and you're not going to have the investment in terms of technological medical advances. You're not going to have basic inventories at a sufficient level. All of that stuff will fall away if you don't have the right systems and reforms in place.
Chris Hattingh, thank you very much. Let's hand over to you, our audience. Do you think that NHI will solve some of the fundamental problems in South Africa's healthcare system? Leave your thoughts down in the comment section below. Also, if you enjoyed this analysis and you would like to become a client of the CRA, you're welcome to join us on our 30-day free trial. There's a link in the description below where you can access all of our reports and data for a limited period before making a decision on whether to become a client. My name is David Ansara. This is the CRA. Until next time, take care.